So the first thing you're going to want to do is mark the measuring spots on your patient's body. During our assessment, we measured 7 sites, beginning with the subscapular, which is 1 to 2 centimeters below the inferior angle of the scapula. We then moved on to the tricep, which is a vertical fold on the posterior midline of the upper arm. We then moved on to the mid-axillary line at the level of the xiphoid and process of the sternum. Should also note that all of these measurements are being taken on the right side of the person's body. We then measured the chest/pectoral area, which was 1/2 of the distance between the anterior axillary line and the nipple. It should be also noted that the calipers are being placed 1 centimeter away from the thumb and index finger. Next came the abdominal area, which was taken 2 centimeters to the right side of the belly button. We then moved on to the suprailiac, which is a diagonal fold in line with the natural angle of the iliac crest taken in the anterior axillary line immediately superior to the iliac crest. It should also be noted that readings are being taken within 1 to 2 seconds, ensuring that the pinch is maintained while reading the caliper. Lastly, we moved on to the vertical fold that is taken on the anterior midline of the thigh. We must ensure that the person is putting all of their weight on the measuring thigh. We will rotate through each site twice, making sure to retest if the measurements are not within 1 to 2 millimeters of each other. We will also need to make sure to rotate through the measurement sites. This will allow for the skin to regain normal texture and thickness, because measuring the same site twice in a row may cause for an inaccurate reading. A difference that occurs when measuring between men and women is in the chest/pectoral area. When measuring men, you measure 1/2 of the distance between the anterior axillary line and the nipple, but when measuring for women, you measure 1/3 of the distance between the anterior axillary line and the nipple. Here are both body density formulas for men and women. You'll see that the only difference are the numbers in the equation, because men and women will have different expected body fat percentages, being that women will have higher and men will have lower. Here are the other two formulas that are commonly used to calculate body fat percentage. The first equation, you take 495 divided by body density that is calculated and subtract 450. For the second equation, you take 457 divided by body density and subtract 414.2.